CBS News medical contributor Dr. Tara Narula is in New York. All right, so Tara, you are a cardiologist, and I'm curious, the president is known to have a penchant for fast food. It's been well documented, not at all disputed. Did anything about his health report stand out to you?
Well, I think the biggest thing is that we know that cardiovascular disease kills more men and women in this country than any other disease. And so that's really what you want to know about someone, is what is their cardiovascular risk? And we found out a lot of positive things in the sense that he had a normal electrocardiogram, which didn't show any evidence of prior damage to the heart. He had a normal stress test. So when he was put under stress, the blood flow to the heart muscle was normal, and he had a normal echocardiogram. So the pumping function of the heart and the valves were normal as well. That's all reassuring in terms of just his overall general condition. We also found out that he doesn't have a lot in the way of some of the more traditional risk factors. So he doesn't have high blood pressure or diabetes, he doesn't smoke, he doesn't drink, he doesn't have a family history. Again, all very positive signs. In addition, however, we also learned that he does have coronary artery disease. He's had evidence of coronary disease for several years now, albeit it's stable coronary disease that still puts somebody at increased risk of future heart attacks. So that plaque in the arteries that supply blood to the heart muscle can break, a clot can form on top of that rupture, and that's essentially when you develop a heart attack. So the bottom line is, we counsel all of our patients with stable coronary disease to make sure that they control things like diet and their weight and their stress. And so when Dr. Jackson mentioned losing weight and having nutritionists come to the White House and increasing his exercise, these are all the things that we would tell somebody who has coronary artery disease.
And on his weight, based on his height and weight, his BMI is considered borderline obese.
Right.
So given what you just spelled out, the cardiovascular disease, combined with that borderline obesity, is there a cause for concern there?
Well, I think it's the same cause that we would have for anybody who has these risk factors. And, we have ways to manage them, as I mentioned, which is, educating people that by losing weight, by taking their medications, by eating a heart-healthy diet, that you can do a lot to lower your risk. So I think, we got a lot of information from this report, a lot of good information, and a lot of information that tells his doctors how they should be managing him going forward.
Finally, Mr. Trump's physical also included the Montreal Cognitive Assessment, in which he scored a 30 out of 30. Can you just explain, what does that test entail?
Right, so this is just testing cognitive ability or function and looking for any evidence of mild cognitive impairment or early signs of dementia. It's not testing somebody's mental or psychological health, and so a 30 out of 30 would be kind of the best score you could get on this type of an exam.
All right, Dr. Tara Narula, thank you.